Good morning. My name is Stephen Buck. I am the president and CEO of Care Providers Oklahoma. Thank you for joining us. Before we start our activity this morning, I think it's appropriate to have a moment of prayerful celebration and reflection. So, Scott, if you would, please.
Thank you, Heavenly Father. We come to you with a spirit of thankfulness this morning. Thank you for the blessing and the honor of serving and caring for our elders. We thank you for hope, the ultimate hope that we celebrate this week in the salvation provided by Jesus Christ, and also the hope provided by this vaccine that it will provide a way out of this long, dark tunnel that we've been in. We're very thankful for the hands and the minds that have created this vaccine, for the officials that paved the way and the research, the paying for, and the distribution of that vaccine, and we appreciate that deeply. Also, Lord, we ask that you provide a hedge of protection, protect our residents, our staff, everyone until these vaccines are in our systems and create the antibodies necessary to fight off this virus. And we ask that you provide that hedge of protection to those getting the vaccine and to the very few, but possible few, that have adverse reactions to this. We ask that you do protect them and to be with us all. We ask this in your Son's name. Amen.
Thank you, Scott, for doing that. So to start our activity this morning, we really want to emphasize today is about the frontline heroes who are working so diligently to serve the residents whom we're entrusted to care for. So our first activity today will to invite a resident of this facility as well as an employee of the Diakonos Group to be the first recipients for this building of the COVID-19 vaccine. So with that, this will occur to my left if you want to adjust your cameras for such.
I know.
How are you today? Good? Did I get this t-shirt? You get abandoned. Oh, you got that. You get abandoned. Okay, relax. You ready? I'm good? You are done.
Yes, we will get the names, and I'll announce it from the podium in a second.
Oh, I'm excited. Oh, my goodness.
We're all excited.
Oh, wow.
That's how it works. None of us do.
Oh, we did it. He's taking it easy on me. I didn't faint.
So a couple of you have asked for the names of the resident and the staff member. The resident's name is Frances Watland, Frances Watland, Watland. The name of the staff member was Pam Byers, Byers. So thank you for getting that, and thank you for that. It truly is an enthusiastic day for us. During the course of the event, there will continue to be vaccinations occurring, specifically the staff members. So as I said, my name is Stephen Buck. I serve as the president and CEO of Care Providers Oklahoma. We are a trade association representing nursing homes, assisted livings, and ICFIIDs across the state, and we're honored to be here today. The Diakonos Group is one of our member organizations, and we truly appreciate, Scott and team, the opportunity for us to come and celebrate with you and your teams today. It's an exciting day. So for opening remarks, I'll introduce Scott Pilgrim, CEO of the Diakonos Group.
Thank you, Steve. Hello and good morning. I want to begin today by welcoming all of our guests to the Lodge at Brookline. This is a special day. It's a hopeful day, and it's a good day for our residents, our staff, and our families. Governor Stitt and Commissioner Frye, thank you for your leadership in your commitment to getting this COVID vaccine into our facilities as quickly as possible. We know that every day that we don't have this vaccine can be measured in lives. So it's not an exaggeration to say that being here today and not tomorrow and not next week, we're preventing an even greater loss of life. To our friends at CVS, thank you for the vital role that you're playing in distributing this drug and providing these clinics. It's truly the kind of professional and public sector partnership that we have in this profession, and what makes long-term care and skilled living unique in the state of Oklahoma. Now, before I introduce my Chief Operating Officer, Kimberly Green, who will talk more about the significance of this day and what it means to all of us, I'd like to introduce this facility and our company. The Diakonos Group operates 20 skilled nursing facilities, assisted living facilities, long-term care homes, and homes for adults with developmental disabilities throughout Oklahoma. At the core of our mission is a belief that every person has value. Our residents, whether they're suffering from the conditions like dementia or physical ailments, have value. We care for them, we care about them, and we love them. Our staff has value. These are the hardest working women and men that you'll ever meet. They do a difficult job and an important job. And they do it all with smiles on their faces because their work has meaning. That's what defines us at Diakonos Group and the Lodge at Brookline. When COVID-19 came into the state of Oklahoma, we took it personally because it was a disease that was specifically designed to target and injure the population of people that we care for and that we've built our lives and our careers around. You know, I sometimes hear from younger women and men, you know, not in the skilled nursing profession, but they say that COVID is only dangerous for the elderly or the infirm, and therefore isn't a big deal. Frankly, hearing that makes me sick, because the life of an elderly resident in a facility like this is no more or less valuable than my life, your life, or anyone else's life. And that's why we fought so hard and continue to fight this terrible virus. It's why we put up and paid for 1,000% markups for personal protective equipment in the early days of this virus. We do that because it's worth it. It's why we ask the friends and the loved ones of our residents to limit their visitation, to distance themselves from our residents when all they want to do is come give them a hug. It's worth it because lives and saving lives are worth it. It's what we do. And now, with this vaccine, hopefully this has gotten a little bit easier. And we're very thankful for that. Now, to talk a little bit more of the significance of this, I'd like to introduce Kimberly Green, the COO of Diakonos Group.
Thank you, Scott. And thank you all for coming out today at what really is a celebration. We saw earlier one of our residents, Frances Watland, and Pam Byers, a longtime nurse, receiving the first vaccinations. And the reason we chose to do a resident and a staffer at the same time was to symbolize that overcoming COVID-19 has really been a partnership. Obviously, our staff and our administration are one part of this partnership. How well we outfit our staff with PPE and how well we train them matters. Their commitment to following protocols and doing things the right way matters. And believe me, those protocols aren't always easy. It's not easy to wear full PPE all day while cleaning the facility, serving meals, or helping people bathe. What we have required of our staff has been necessary, but it has been difficult. And I want to thank them for their work and recognize them as the heroes that they truly are. The second part of this partnership has been with our residents and patients, because they are not passive actors in this fight against COVID-19. They are active participants. They are foot soldiers in a war against this virus, and they have sacrificed so very much. I don't think I need to tell you how hard it is to be isolated from friends and family, or to give up communal dining with friends, or game nights, or holidays, or hugs. You can measure the toll that COVID-19 has taken in lost lives, but you cannot measure it in the human connections or quality time that has been lost. Today isn't the end of the fight against COVID-19, but it is the end of the beginning. We have a light at the end of the tunnel. Not all of our residents have chosen to be vaccinated today, and we can't and we won't make them. But I think when they see this group come in, full of excitement and hope, it will make that decision an easy one. In the meantime, my ask to the public and to all of you is the same as it's been for 8 to 9 months. Please take this threat seriously. Be kind. Please wear a mask. Socially distance. Wash your hands. Help us all with just simple, thoughtful actions. We know that communities with COVID-19 outbreaks eventually lead to nursing homes with COVID-19 outbreaks, and that's just a fact. We all have to work together to stop this now. It will take months before every skilled resident and every senior has this vaccine, and until then, we must keep our guards up. That is especially important as we approach the holidays this week. In closing, thank you to all who made this day possible. Governor Stitt, Commissioner Frye, and our partners at CVS, and for our staff and residents, our heroes at the Lodge at Brookline, this is your day. Enjoy it and know that we will continue fighting for you because you are and will always be worth it.
A quick transition just to underscore the fact that today we're at this facility initiating this process. This process will be unfolding over the next several weeks and in fact started yesterday in buildings and communities across the state. So we encourage you to continue in your role to remind people that this is an ongoing process and that those very important measures that Kimberly talked about, wear that mask, practice your distancing, washing your hands, will continue to be of utmost urgency. So now it's my honor to bring to the podium Governor Stitt. Thank you for coming today. I want to say this as introduction, that one thing I've been extremely impressed with, Governor, and the interactions you and I have had over the last several months, and certainly members of your cabinet and members of your agency leadership team, there are a lot of hard policy conversations that have to be had. But it has always been central in the conversations to ask how our employees and how our residents are doing. And I appreciate that focus and want to say thank you to all of those who work with you in the executive branch for that commitment to Oklahomans.
Well, thank you so much for that, Steve. I appreciate that. And Scott and Kimberly, thank you all for having us here today. It's our honor to be here. And to Oklahomans, this is a big day. We're getting the vaccines into nursing homes, long-term care facilities, and it's a major step forward in our fight against COVID-19. In the first week since the vaccines arrived in the state of Oklahoma, we have given it to 21,000 healthcare workers and first responders. That number includes people from all 77 counties in the state of Oklahoma. Yesterday, the first shipments of the Moderna vaccines started arriving at county health departments, and we received about 10,000 doses yesterday, and we're on track for about 50,000 more doses who are on the way today, some more that we'll get tomorrow. Getting these vaccines at our county health departments will allow us to send strike teams out across the state. They'll be able to quickly and effectively administer it where it's needed the most. And as we've said, Kimberly said this, today isn't the end of our fight, but it's the beginning of the end. I know this has been an incredibly hard year on all of us, especially for Oklahomans who live and work in our long-term care facilities. You know, we've made the families of these long-term care residents, they've made window visits. We've talked outside from safe distances. They've used FaceTime and Zoom calls to visit their loved ones. But at the same time, we know that that's not the same. No matter how old we get, sometimes all we want is a hug from our mom and dad, especially in a year like this one. This virus has caused so much stress on so many people, including those worried that they might get their parents or their grandparents sick. And so many Oklahomans have made sacrifices to keep our long-term care residents and their staff safe this year. This includes the frontline healthcare workers and who risk their own lives and safety to protect them. It also includes the residents who have had kind of their way of life turned upside down. They've accepted restrictions on visits, eating their meals with friends, and many other changes. And on behalf of all 4 million Oklahomans, I want to say thank you. I know it's been hard, it's been a long year, but we are going to get through this together. This vaccine is an important part in our fight against COVID. And I insisted that we prioritized long-term care residents and the staffs in the prioritization of the vaccine. One of the ways we can get this vaccine out so quickly is through the federal government's partnership with CVS and Walgreens. And I want to thank CVS Health for being here today and for helping to protect Oklahomans from this virus. Now I want to turn it over to Regional Director Shay Hudson. Shay?
Thank you, Governor. I'm Shay Hudson with CVS Health. I'm a Regional Director. I first want to thank the Governor and his team for all the support and the energy they've poured into this COVID-19 fight. Thank you guys for allowing CVS to be part of that journey and part of the solution. As we stand here today, we stand with heroes. So I want to first applaud all of the CVS pharmacists, interns, and nurses that will be deployed to all of the long-term care facilities across Oklahoma. CVS has had the opportunity to already be in some nursing homes in Oklahoma, and what I will tell you is this is bigger than healthcare. This is healthcare with heart. We are bringing families together, we are delivering hope, and we are bringing communities together that have supported one another through a turbulent 2020. As I think about the journey that we continue as we move forward in Oklahoma, CVS is proud to be part of this journey. The vials of hope that will be delivered are so exciting, not only for the residents and the family, but for the healthcare workers that have worked tirelessly to protect those in need. So thank you, Governor. Thank you, Commissioner Frye, for your work. CVS is very proud of the work that we're doing, and we are committed to delivering industry-leading healthcare as we move forward. Commissioner Frye, thank you.
Thank you. What an exciting day. I mean, I just almost speechless when we're going around doing this right now, because we finally have a message of hope and just really something that we can do that's going to make a difference. You know, every one of these vaccines can save lives, and just excited to be here. You know, last week we made history in Oklahoma as we received our first shipment of the COVID-19 vaccine through Operation Warp Speed. And over the last week, thousands of frontline healthcare workers across rural and urban Oklahoma have received their first doses. As you heard the governor say, we've administered 21,000 doses so far, and done it in all 77 counties. I was talking to Deputy Commissioner Reed earlier today, and we feel like we're going to be able to start into phase 2 of our distribution through certain parts of the state as early as next week. We anticipate receiving and distributing a total of 174,900 vaccine doses before the end of this year. This marks the beginning of a new trajectory in our fight against COVID-19. With more shipments of both Pfizer and Moderna vaccines slated to arrive in the coming weeks, we'll keep moving forward with our vaccination plan to help get it to those who need it most. I'd like to thank our public health staff and vaccine distribution partners who have made all of this possible. Thanks to our federal pharmacy partners at CVS and Walgreens. This week, we began expanding our efforts outside of hospitals, and will continue administering the vaccine to Oklahomans working and living in long-term care facilities. This year has been especially hard for those people, especially dealing with isolation, and we're hopeful that the effectiveness of this vaccine, paired with other preventative measures, will save lives and allow long-term care facilities to resume regular visitation for family and loved ones. The holidays are quickly approaching, and we know that Oklahomans look forward to this time of year to spend with loved ones and extended family members. However, it will take time for the vaccine to be effective, and we ask families with loved ones in residential care to be gracious towards these facilities. They've been wrestling with the harsh realities of COVID-19 every day. When appropriate, we encourage you to continue utilizing low-contact methods for socialization with family during the holidays. If possible, take advantage of the weather and participate in outdoor visits. We understand that the holidays look different for many this year, including myself. This holiday season, I ask Oklahomans to keep working together to protect those around us so that we can celebrate the holidays together again soon. Now I'll turn it back over to Governor Stitt.
Thank you so much, Dr. Frye. We're just 3 days away from Christmas, and I'm reminded of Oh Holy Night. 2,000 years ago, the world was dark, people were weary, and I know some of us are feeling the exact same way now. Some are worried about the health of their loved ones. Others are mourning a loss here in Oklahoma. Some are scared for their jobs or their business. Others are just worn out from the stress that this year has caused. But I'm here, like all of the panelists up here, hope is on the way. We have 174,000 vaccines coming by the end of this month. We are executing a well-designed plan to get this vaccine to everyone in Oklahoma, no matter where you live in the state. And I want to also echo and thank Deputy Commissioner Keith Reed and his team for all of the long hours and the work that you guys have done. This isn't easy, but I truly believe Oklahoma is leading the way of getting these vaccines out across the state. We have light at the end of the tunnel, but this virus is still here. So please continue to practice the 3 W's to protect yourselves, your families, your neighbors. Wash your hands frequently, watch your distance, and wear a mask. We will get through this together. Let's just continue to do our part. And now I'll open it up to a few questions from the group here.
Two questions. First off, are they giving them a Moderna vaccine today, or is it the Pfizer vaccine? Pfizer. And then second question, I think is for Dr. Frye. You mentioned that we might move into phase 2 of the vaccine plan next week. Is that, why is that? Is that because uptake has been kind of low?
Why don't you come up to my hand?
No, actually, we've had really good uptake. We are just moving quickly through our plan, and I think we're doing very well. We've got it to the hospital systems, and now we started with long-term care and some of our EMS first responders, and we're moving through it pretty rapidly. It's been in all 77 counties, and I think we're going to be progressing pretty quickly. Do you have anything else to add? Sure.
I would just want to add that we've mentioned all along that we want to make sure that we do this as efficiently and effectively as possible, which means that we're going to have concurrent operations. So just because we talk about moving into phase 2 does not mean that we're completely done with phase 1. We have overlap, and we need to do that for efficiency's sake. If we were to wait till we completely finish one group before we started another, then that just delays getting vaccines into Oklahomans. So our purpose here is to make sure that we can move forward as efficiently and effectively as possible and get moving on getting more vaccine into Oklahomans.
I have a question about vaccine. Maybe it's sort of one of the positions, but you said you can't force people to take the vaccine, and not all of the residents say they will. How will you convince people to get this vaccine, especially who are the most at risk?
I can talk some on that as well. I think what we're doing now is a big part of that. We want people to see other people stepping up and getting the vaccine and seeing that they're doing fine. Some of them don't even know when they've gotten it. They tell them they're through and they didn't even know that you started. So, we want everyone to see that it's okay. People are fine. They're not having as more than usual side effects that you would with the vaccine, and it's safe and effective.
You had the vaccine the other day. Have you had any fatigue? Is it similar to the flu vaccine?
It was actually easier than the flu vaccine. I didn't feel it at all when they gave it to me, and just later that night, I kind of rolled over and my arm was a little sore, but that was it. So, great.
I did have a question. I'm sorry for maybe to follow up on Bill's question. It said that you said that you can't force, or I believe you said you can't force residents to take it. And if I'm not mistaken, there are certain requirements that patients must have to move into a facility like this, right? There are certain requirements. So are you looking at any sort of requirements for new patients moving somewhere? Obviously, you're not going to throw somebody out if they're refusing to take this vaccine, but are you going to require any new patients, in the next 6 months to have taken the vaccine?
Well, no, I think it's a great question, Scott. Come on up, and I'll let you talk about that from a specific facility operation. But as far as our role as a trade association, what we're focusing on is making sure that our members' providers have have access to for their employees and their residents. Good, sound medical literature. It's extremely important that we make sure that they have the available resources needed to make those decisions. We understand that there will be employees and residents who will be weighing through this process, and from our standpoint, we need to make sure that their decision metric is influenced by valid medical information.
You know, we're still in a free country, and people have constitutional rights. I don't believe that under CMS rules that we could have a requirement that would make our residents take this vaccine or any vaccine, especially one that's under an EUA from the FDA. However, I can tell you that looking at the percentages of our residents that are getting this vaccine and our staff as well, we're going to have a great flip here. Nursing homes are going to be the most safe place in the country for seniors in about 30 days. Because of the level of immunity that we'll have built up within our walls, there will be no safer place in the world for a senior to be than in a nursing facility. That will be the ultimate driver for people to get the vaccine.
Do you mind sharing the percentage of people getting the vaccine and people not getting the vaccine inside these walls?
Actually, we have 3 clinics, so our number, and this is our very first clinic, so I don't know that yet. I know that we've been having education sessions both with our employees and our staff, and they've been very well received.
And how many people have had COVID-19 here?
In this particular building, Christine, can you help me with that? If she's around, well, she must be taking care of folks. How many folks have we had in this building with COVID?
About 10, including residents and staff.
Yeah, 10 residents and staff, which is a very, very, very low percentage compared to statewide averages and even within our company.
Most residents are interested in taking it, or more than half not interested in?
We expect that number to be in the 90% plus range.
Commissioner Frye, you talked about people having patience as you start this process with residents of long-term care facilities. I mean, I know this is only the first round of vaccines, but do you all have any idea for how long it'll be before people get access to their loved ones? Is it after that second round of vaccine, or just for people at home that want to know the timeline when they can go, hug their mom or grandma?
I'm going to leave that up to the long-term care experts to answer. Again, it will take about 30 days before, from the date that a person receives their initial dose till they have the 95% effectiveness that we need, so the immunization from it. And I think it really depends on what's going on in our communities at that time, the rate of community spread, how much that's come down due to the vaccinations and in the facilities. But it's kind of a fluid progress, and I'm not sure exactly the correct answer. I would leave it up to them to give you that.
The advisory committee for vaccines recommended changing the phase 2 recipients to Moderna, including they want grocery workers, postal workers, correctional employees, all that they have been told to be in phase 2, and they want the 65 and moving forward in the bump to phase 3. Is the state going to take that advice, or are they going to stick with their plan?
For now, we are sticking with our plan. We, again, this is fluid, and as we've said all along, those phases really don't have walls around them. They will be going concurrently between, a phase 2 and a phase 3, or phase 2 and phase 1. We'll be doing operations at the same time, but we have an independent board that has worked with us on this, and we'll be talking to them about those recommendations.
Well, there are thousands or hundreds, if not thousands, of long-term care facilities throughout the state. Are you starting first in, let's say, communities with higher rates of transmission, and then moving to communities that have lower rates of transmission? Or just, I guess my question is, how do you decide which nursing facilities first?
Our partners are the ones that are scheduling that, so I'm going to let them answer. We are taking care of the few facilities. There are very few facilities that actually didn't sign up with them, and so our health department is taking care of those, but they're doing the remainder.
Yeah, I'll interject on that. So the way that we schedule where we are is really determined in partnerships with the nursing homes. and when they would like for us to be there, as well as when we can logistically be arriving at their location. We've deployed over 60,000 pharmacists across the United States to nursing homes, and we will deliver the initial vaccine within a 3-week period to all nursing homes from start to finish in the U.S. I also wanted to interject on your question around the number of employees or residents that are receiving the vaccine. Having been in, we do have a small pool so far, so I don't think we have exact numbers. But I will tell you, having been inside a facility, the emotion around the vaccine is excitement. You stand in one of the residents' rooms and their families outside taking pictures and cheering. The residents are crying with excitement. So there is very few residents that we have not vaccinated across the nursing homes we've been a part of, because they are truly looking for the solution to be reunited with their families.
Any questions?
I have a question unrelated to vaccines. There's been a pressure, amount of pressure to call a special session to fix some voting, some ballots, and also moving meetings. Are you looking at calling one of those, Governor?
Well, we worked with the Senate and the Speaker and the Pro Tem about that. We said, hey, if you guys want to do a special session to solve this issue, just let us know, and we're open to that. I signed an executive order early on that allowed Open Meetings Act, and then there was legislation passed on that stopped it on November 15th. The complication that they're dealing with from the Senate and the House is they don't form the new, basically, session until January 5th. And so you've got a window that you could potentially get this thing fixed between, call it a week after January 5th, and then we're going to be back in session on February 1st. And I would hope that they would resolve it really quickly. If we don't get a chance to do a special session in that 2.5-week period, that we get this resolved very quickly early on, and take that up really February 1st.
I guess they're not just giving you their weekly reports anymore. They said that, if you want the report, you have to ask for it. Is that something you're going to be asking for from here on out?
So it's my understanding that they're posting all of that stuff on their health website, and so the information is available to the public, and so I just think there's a change in how they are positioning it. So the information's out there as far as we're concerned. And that's my direction to the health department here locally, is we're going to be transparent with every piece of data that we have, give it to Oklahomans, and that's what we've done from the very beginning of this. So I think that data is still available for you if you want to go check on it.
I think the data is there, but I think the recommendations for specific states are not. So I don't know if you've heard anything about.
Yeah, if our team wants any specific recommendations, they can call them for it. But the data is there, and I'd leave that up to these guys if they wanted to get more recommendations from them.